Good morning, everyone. Some of you've heard me speak before, just by way of introduction. Some are familiar faces, some aren't familiar faces. Nice to meet you all. My name is Kaushal. I'm an MD, PhD person. I used to be head of Retinal at University of Florida and then transitioned to private practice. For the new drugs in retina, we were blessed to be the first to use in the world, and we continue to develop other new novel treatments as well. My PhD is in biochemistry and molecular genetics, and over the years it evolved into nutritional biochemistry and metabolic medicine. So yes, I'm an ophthalmologist and retina specialist, but I also have a very long-standing, passionate interest in metabolism because of my biochemistry background. As a consequence, with our patients, those who are interested, I talk to them in specific about other things besides their eye. It turns out the retina is a very sensitive barometer of overall health and nutrition. So anything that's happening in the body is reflected in the eyes, particularly in the retina. The retina is the only place where you can see blood vessels in the entire body. It's also part of the central nervous system. So even the earliest changes before cognitive impairment with Alzheimer's disease can be picked up in the retina. Obviously, disorders like macular degeneration and diabetic retinopathy are manifest in the eyes, in the retina in particular. I got something in my throat. Is there any water someplace possible? Maybe in just a bit. So that turns out to be incredibly important to be able to see central nervous system, tissue, and blood vessels. Geez, it's really dry in here. In any case, what I want to talk to you about today is something that's really close to my heart, and many of you are aware of it already because you get this kind of testing done with your internists and primary care doctors and cardiologists. So I'm going to start backwards. I'm going to talk about vascular health in just a moment, but what I really want to talk to you right now for the next 15, 20 minutes is about lipids, right? Now, all of us are familiar with going to the doctor and getting a physician and getting your lipid panels, right? Point number one, you want, all of us, not just you, all of you, but me as well, we all want a lipoprotein analysis. A lipid analysis is not very meaningful, okay? I'll repeat it again. The typical lipid panel is not particularly meaningful in this day and age when we have such excellent testing. And I'm going to show you some pictures in just a moment. Carl, it'll say that. That's weird. Try it, unplug it, and then try it again. Okay, so that may sound shocking. It's not meant to be shocking. It's just really the truth. In 2022, with the sophistication of laboratory testing, a standard lipid panel is not very meaningful. The only number that's really meaningful on that entire, you hear about everyone talks about HDL, LDL, you see it on TV, you see it on the web, right? Those are not meaningful numbers. The only number that's meaningful on that panel is the triglycerides, okay? That's the total cholesterol is not meaningful, and I'm going to explain it to you in just a moment, as soon as we can get these slides to come up. If they don't, I'll explain it to you in words. So that's the first thing. Now we hear, so point number two, and as soon as this opens up, I'll show you all of this as well, so it's visually, you can remember it. We hear about LDL cholesterol all the time. Oh, thank you, that's so sweet of you. Yes, yes, thank you.
Is it right now?
Vascular, okay, we found it. Okay, so that's number one, right? Total cholesterol, we hear about total cholesterol all the time, right? Total cholesterol is a composite of various lipoproteins that carry cholesterol in our body, right? In fact, it's a composite of all the there's a whole set of lipoproteins, and I'm going to show you just a picture of it as soon as this file opens up, this presentation opens up, okay? Now, here's what the testing that you really want to get done. Apo B, you can write this down, APO capital B. That is Apo B is a protein that's found predominantly on LDL cholesterol lipoprotein particles. So when you hear the word LDL cholesterol, that is actually not a measured entity. It's actually derived from some other calculations. You know what I want to do? There you go. All right. So here we go. Now I have visual crutches. Okay. So these are the various particles. If some of you are sitting in the back, you're welcome to come forward. Okay, so the way these particles are determined in our bloodstream is you get blood drawn, you let the blood coagulate, and then you spin it in a centrifuge. And depending on where it settles out in the centrifuge, right, that determines the heaviness, the density of those particles, okay? So the largest ones are the chylomicrons, and those are increased dramatically right after we eat, and then they subside over time. And then there's these other particles, intermediate density lipoprotein, LDL, right? LP little a, we're going to talk about that in a moment, and HDL, okay? Now we hear about HDL being a protective lipoprotein. That's true, right? But amazingly, even as of today, now if you talk to, by the way, this is a sidebar. These slides are taken from a good friend of mine, Thomas Dayspring. He's one of the godfathers of lipidology. He's an internal medicine person. He's retired now, but incredibly, every time I talk to him, I learn gobs more, right? And he has spent the bulk of his adult career teaching internal medicine, primary care doctors, and cardiologists. And he's as passionate as ever about sharing his amazing knowledge. And he's written many articles, book chapters, and his presentations. They're just amazing. Each slide, I know how much effort it takes to make one slide. His slides are they're like masterpieces. They're like Picasso's of lipidology. And so I was talking to him maybe earlier, maybe about 4 or 5 months ago, and we were chatting. I said, Tom, you know what I don't understand? I've been studying this intensively. It turns out it's very relevant to the eye, and I'll tell you why in just a moment. And the retina and overall health, not only visual health, but overall body health. I said, what's remarkable to me is when I talk to my very good friends in internal medicine, cardiology, and in family medicine, hardly any of them are aware of this. And he chuckled on the phone. He said, he's been doing it for 40 years. He said, that's still true. It was true 40 years ago. He said, there's a little bit more awareness now, but still very limited awareness. Because in fact, what I'm going to share with you is what we learned originally in medical school, but the proper way to actually assess somebody's risk for cardiovascular disease and vascular health is with these tests that I'm going to tell you about. And they're available, by the way. It's not like they're magical. There are some places, some labs like Boston Heart and Cleveland Clinic Lab, which offer them. Some of them are covered by insurance if somebody wants a more complete panel. Quest and LabCorp have some of these tests. I'm not sure how reliable they are. I know Quest bought Cleveland Clinic Diagnostics is what it's called. It's not part of Cleveland Clinic. They're testing panels. And as I said, a set of them are covered by insurance and a set aren't. But I would tell all of you, it's worthwhile to spend the money if you need to, right? If it's not covered by insurance to get these testing done. And I have no financial interest in these lab companies. Okay, so here's what I really want to show you. So I showed you these particle sizes. So it literally means how big these particles are and where they, after centrifuging for a long time, where they settle out in that test tube, okay? So these are the large ones. intermediate again, the LDL, and the LP little a, and then HDL. Now I'm going to preempt myself. So I told you about getting Apo B levels, right? What is Apo? Well, this is not preempting myself per se. Apo B is one of the proteins. See, the composition of a lipoprotein is a combination of cholesterol, right? These surface proteins and these phospholipids, these little, they look like little spokes on the surface. Again, this is from Tom Dayspring. This is one of his one of many, many amazing slides that he's developed over the years. Okay, so now here is, so some of the testing that can be done. Let's see if I can make this. Oops, that's the wrong way. There we go. All right, here's another picture, okay? Again, all of these are from Tom Dayspring, and so I acknowledge him right up front. A wonderful man. I was trying to convince him, by the way, to come down to, I run this annual meeting. We haven't done it because of COVID. This annual meeting called Reversal of Chronic Diseases. I wanted him to be a speaker. And I may still be able to twist his arm to do that if I do it in wintertime and it's cold up north, and he may come down. But we may even get him virtually, because he's just a fountainhead of information. Okay, so here we are. I told you about Apo B. What is the composition of Apo? Apo B is the composition. That protein is found on 3 different lipoproteins, right? VLDL, IDL, and LDL. And so you're going to ask me, well, geez, why are you telling us about Apo B? Apo B is that marker. So the bulk of this, before I tell you what it is, the bulk of this in our bloodstream, we just did lipoprotein analysis of everybody here right now, predominant will be LDL particles. Apo B, this particular protein that's found on the surface, this squiggle here, right? That protein has been clearly associated to be atherogenic. What does that mean? It means it can migrate underneath the blood vessels and initiate atherosclerosis. That's the way to think of it, okay? So when you get tested, yes, it's great. I'll keep repeating it, so hopefully it'll be cemented in your mind by the end of this talk. So when you get your blood work done, you can get your standard panel done, but that's, as I said, it's not particularly useful per se, except the triglyceride levels, right? Now, the triglycerides, so this is again, you can see here, it constitutes all of these lipoprotein particles, right? So see this purple here, that's the purple, that's the triglyceride that's found inside each of these various lipoproteins, again by size. So the triglycerides turn out to be important. What's the easiest way to reduce triglycerides? Fish oil, right? Some of you who come to see me in clinic, actually the best is cod liver oil. Right? So a tablespoon a day. It stunk when we were kids because it was rancid, right? But the techniques to isolating it are much better. We take it for good health, right? It has not only is the highest concentration of omega-3 fatty acids per weight of any of the omega-3 fatty acid supplements, including fish oil, krill oil, borage oil, and so on. Second, it has vitamins A, D, and E in it, right? They turn out, in modest amounts, not large amounts, but they turn out to be wonderfully protective of the brain, the retina, the heart. And they have a set of compounds called the retinoids, and some of you may have heard me say this before. Retinoids, we discovered when I was at the University of Florida, actually improve visual function, okay? And it turns out they have an anti-carcinogenic property, so they limit cancers. And in fact, they were, for the longest time, being explored as chemotherapeutic agents. But that's a little bit of a sidebar. So here we are, again, to review, right? The triglycerides measure this purple material in each of the different types of lipoprotein particles. Total cholesterol, so these yellow spots, which correspond to this, is cholesterol in this figure, right? So this is total cholesterol, right? So you're going to say, well, geez, that should be a good number to follow. It is in some instances, but in many instances it's not so valuable per se. And that's another separate wonderful discussion, but we'll leave it as I want to try to simplify it enough so it's meaningful for all of you and you can do something about it, right? Okay, so that's to just give you a visual appreciation of what these particles look like and how they're isolated. Now this is the typical panel, right? When you go to when all of us go to our primary care doctor, cardiologist, internal medicine doctor. Total cholesterol, you see LDL cholesterol, that is a derived number, that is not directly measured, okay? HDL cholesterol is directly measured, right? Triglycerides can be measured, and this is all, here it even tells you it's a calculated number, right? The only one, to reiterate again, that's really important here is triglyceride levels, okay? Now, let me show you the panel, come right to the punchline for it. This is the analysis that you want, okay? So, I told you about Apo B. The reason why Apo B is so important, again to reiterate, is it's atherogenic. It promotes atherosclerosis, right? The invasion of LDL particles that have apobria on their surface underneath the lining cells of the blood vessels. That's the stimulus for developing atherosclerosis, right? So what are the risks, by the way, right? So the risks of atherosclerosis are, of course, age, right? High blood pressure, and also diabetes. Those are the common ones. And cigarette smoking, sorry, that's the other big one. We're going to come back and talk about that in some moment. Yes, please. Oh, okay. Blood pressure, diabetes, smoking, and age. Okay. What are ways to mitigate against it? Exercise, for example, right? So even going for, some of you have heard me say this in clinic, that even a 30-minute walk every day is profoundly effective. Let me give you a sidebar before I tell you this chart. If you go back to the Framingham Heart Study, which was done many years ago, that's one of the major, it's the longest ongoing clinical study funded by NIH, as I understand it. What they showed was LDL cholesterol was only 50% of the time correlated with a heart attack, right? Because they never had the opportunity at that time to measure Apo B. They didn't have the assays to do it. So you scratch your head, say, okay, why are we targeting LDL cholesterol? I'll tell you why we're targeting it. In fact, I'll tell you right now. The purpose of all statin drugs is to reduce Apo B. That's the game. That is the game in all of atherosclerotic disease, is to reduce Apo B levels, right? And there's many ways. Statin drugs are useful in a set of patients, not all patients, right? And there are other drugs that have been developed, these PCSK9 inhibitors, which are also very profoundly effective, right, in reducing Apo B levels. So it's really our goal for those who have high Apo B levels and other risk factors, like I mentioned to you. That's really the goal, is to drive down Apo B levels by whatever methods that are available, right? So at the same time, you can reduce total, if you have, if someone has elevated triglycerides, you want to reduce those as well. And as I mentioned to you, fish oil is one way, and exercise is another way. Here's another point. We hear about reducing cholesterol consumption, right? And I don't think I included it here, and perhaps I'll do it next time. So there's so much to talk about. Actually, I'll tell you, I got another sidebar. Tom Dayspring, who I keep referring to. There's a couple other giants in this field as well. I've been fortunate, I have most of his live presentations of his major talks. If I started going through those, we'd be here for the next 72 hours. I mean, there's just so much to learn and understand. But I'm trying to summarize it in a way that's meaningful to all of you. So if you look at, getting back to this, there is a place for statin drugs, right? They have to be careful. Statins have other untoward effects in the body, for sure, right? It turns out that by inhibiting cholesterol synthesis, right, they can affect critical functions in the body. Cholesterol is needed for the retina, the brain, the sex hormones, which are important for all of us for our overall metabolic health, right? So there's a place for it, in appropriate place for it. It shouldn't be the case that it's a knee-jerk reaction. You have elevated total cholesterol, LDL, boom. A patient needs to be on the statins. No, that's not the case. And let me tell you why right now. What's really important to know is not LDL cholesterol. Okay, I'll repeat it again. What's really important not to know is LDL cholesterol on that previous chart. What's really important to know is two things. The total number of LDL particles, that's what the P stands for, okay? The particle number, right? And the next number, the size of those LDL particles. Here's why. You could have very high LDL particle number, right? But if the size of them is large and fluffy, as it were, right, then the chance of developing atherosclerosis is more limited. But if the particles are smaller and more dense, right, you can think of them, I give an analogy, it's not a perfect analogy, they're like little BBs, right? They can get through the vessel wall. So what we really want to know, all of us, is LDL particle number, right? And the size. Are they small or large particle numbers? And this table, this is a wonderful table. I use it as a nomogram. For those patients who come to see me and they want to talk about this, I tell them, look, here, go get this testing done, and then let's review it together.
Dr. So you're saying that the smaller and more dense the particles are, the greater the incidence of atherosclerosis?
Yes. That's clearly demonstrated. It's unquestionable. It's absolutely verified by many clinical trials and peer-reviewed literature. Okay.
What was your question?
The question was, is it the small, dense LDL particles that are atherogenic, or more atherogenic? And the answer is yes. Okay? All right, now, I want to we'll come to these others, but let me talk to you about the other one. This is the other one that I want you to write down if you're writing this down, is LP little a. LP little a is a protein also that can be, it can be genetically inherited, by the way, the predisposition of having LP little a, okay? All right. So LP little a is a protein found on the surface of lipoproteins, right? And it also it's even more significantly atherogenic than Apo B. Okay. So I told you so far, just to summarize it, right? It's important to know triglyceride levels. You want to know Apo B levels. You want to know LP little a levels. Okay. Let's keep going with the alphabet, right? ApoA1 is a protein that's only found on HDL cholesterol, lipoprotein particles. That's another one that's important to know, okay? So, and I'm not going to go through these per se, because that's a more nuanced discussion. What I do want to tell you is, and I had said it before and I'll repeat it again, is that HDL is protective, right? Think of it as the protein that's taking cholesterol from the bloodstream back to the liver, okay? We don't exactly understand its function. There's lots of wonderful scientists and clinicians around the world working on it. But as of right now, we don't understand its entire biochemical function, except this protective effect against atherosclerosis, okay? In fact, in the Framingham Heart study, HDL cholesterol was clearly shown to be protective, right? So, let me just fill in that piece. Remember I told you that LDL cholesterol was like a coin toss. 50% of patients who had heart attacks had normal levels of LDL cholesterol, and 50% had elevated. So what is correlated most significantly and tightly with atherosclerotic disease and developing a heart attack or a stroke? It's Apo B and inflammation in the body. Now, many of you have heard me talk about inflammation as a driver for every chronic disease in humans. That turns out to be true. Atherosclerotic disease, macular degeneration, glaucoma, Alzheimer's, diabetes, right? Age-related muscle loss, age-related kidney dysfunction, right? So it's this low-grade, it's not the inflammation that you get when you have a cut where it hurts and it gets swollen, right? This is low-grade inflammation. Most folks can't even feel it, right? I have some patients who are very sensitive to it, and they know when their inflammatory or inflammation has increased in their body because their vision goes down, right? And they come to see us. And I've followed many of these folks over the years, right? So inflammation, which is not shown here, but you should write this down as well. What tests you should get for inflammation, there's two. HS, highly sensitive, that's what the HS stands for. CRP, in capital letters, CRP, C-reactive protein, okay? And the other you can get is what's called a SED rate, or ESR. Those two are sensitive. There's other tests, in some patients I get additional tests as well, but those two are wonderful sensitive markers of inflammation in the body, okay? So, any questions so far? Yes?
When you do that inflammation,
Oh, what do we do? I'm gonna come to that. Yes,
Does
please.
the doctor have to order them for you?
I'm sorry?
Does the doctor have to order them, or can you go to a lab and have them taken?
Okay, I mentioned to you these two labs, right? This is actually taken from Boston Heart. It's just a sample, right? That lab, I actually spent some time investigating these labs. You know, the two most common ones, of course, are LabCorp and Quest, right? They're good for routine blood work, right? For some of this if you want this type, or if the patient desires this type of analysis, and like I said, I really encourage everyone to get it. Yeah, Boston Labs or this Cleveland Clinic Diagnostics, Cleveland Clinic Lab, I should say. It's not affiliated with Cleveland Clinic, but that's what it's called, okay? So you have to find out, right? I have accounts with both of them ourselves, our clinic, but we're so busy. I usually provide it for our patients. If they really want it, we give them the lab slip, and they actually, the box for the blood draws and so on, we can hand it to patients if they'd like that. As I said, it's really, I will tell you, and again, I have no financial interest in Boston Heart. They have the most complete metabolic analysis outside of one or two. I use one or two other labs. Genova, which is outside of Atlanta, right? Between that and Boston Heart, I can get almost everything that I need to get done for patients who are interested in this, right? Yes?
Are you doing the ones in your office?
No,
or you
with,
sending us-
you get the box, and then you can go to any phlebotomist, right? And then basically you FedEx, they give you the FedEx slip and everything, you just FedEx it to them, okay? Yes?
Is it possible that if you were on a low carb diet,
Yes?
your total cholesterol went up,
Yes?
but the other three?
That can happen. When you go into ketosis, total cholesterol or triglycerides can go up.
But the total, and you got tested,
Yes?
the first three markers?
Yes?
Stayed the same?
Yes?
That's possible?
That is possible, and that needs to be addressed, for sure, right? But that's a
Well, if the first three numbers were normal
yes,
prior to starting low carb,
yes,
and they remain normal,
that's wonderful.
but total cholesterol went up,
Yeah,
that could happen.
that can happen, but that's not so bad. That's not necessarily bad,
Well, no, I understand.
right?
But then you have a primary care physician, most of which don't advocate low carb.
Yes.
Prescribe statin.
The statin, remember, is to drive down this, Apo B. You have to,
But a primary care doctor would never prescribe a statin, hopefully, if those first three markers
correct,
were okay.
should never. You don't need it, right? That's true. Low carb diet, that's another fun conversation. Low carb diet or going into nutritional ketosis, there's overwhelming evidence that it's good for the body, right? From treatment of cancers, right? Treatment of Alzheimer's disease, treatment of coronary artery disease, or mitigating, I should say, right? So going into nutritional ketosis is actually a good thing for the human body.
And inflammation.
Absolutely. Ketone bodies, which are increased on a low carb diet. So low carb, high fat, right? Healthy fats, you know, avocados, right? Salmon, right? Pecans, almonds, walnuts, the fats from those. Those fats are really good for our body. Coconut oil, right? And obviously all in limited amounts. Those can promote nutritional ketosis and ketones themselves, right? So we hear of ketones as in ketoacidosis in diabetics. This is different than that. This is very low levels of ketones, more than baseline. But they are, it is true, they're anti-inflammatory. They're actually excellent for blood vessels, right? And it turns out in the brain, right, ketones, so the major energy source for our cells is what? Glucose, right? But more efficiently for producing energy are ketones better than glucose. So if you can create nutritional ketosis, nothing like it, right? In fact, a lot of elite athletes over the last 2-3 decades have switched to a low carb, high fat diet to induce nutritional ketosis, like these ultra marathoners who run 100 miles a day. It's exhausting thinking about it, right? Right. This is what they do. These Olympic athletes, right? Many of them have opted to or found fine for their bodies that nutritional ketosis improves overall metabolic function and performance.
I think there's a misconception about keto when it comes to that. Because I've learned there's clean keto and dirty keto.
Yes.
And dirty keto is relying on lunch meats and processed.
Oh, yeah, never.
Bacon and
Yeah,
stuff
yeah,
like
yeah,
that.
yeah.
You know, it's low in carbs, so it must be good.
Well, it is true, you know, bacon, lunch meats are low in carbs, right? But they're loaded with inflammatory compounds. That's the catch with those, okay? Other questions so far? Good. All right, so hopefully, let me just summarize this and then I want to turn to something else, all right? There's obviously plenty to talk about. Perhaps next month we can continue this. This, to me, it's nice to have a 15-20 minute discussion of this, and then we'll keep building on it over a period of time, and hopefully your understanding will continue to mature as my own does as well. And it's kind of fun sharing it with people because there's something you can do for yourself. Okay, to summarize, right? Again, to repeat, it's important to know total triglycerides, and you want to really know Apo B levels, LDL particle size, particle number, particle size, small or large, right? You want to also know LP little a and Apo A1. A1 is actually a composition of all the HDL. There's many different types of HDL lipoprotein particles, and that particular protein is only found on HDL particles. Okay, good. Now, why is that? Yes, please.
What do you do about the inflammation?
I'm coming to that. So the question really becomes, so let me tell you another sidebar, by the way. It turns out cholesterol has wonderful antiviral properties. including the one that's consuming the world right now, COVID-19, right? So when we think, there's this perception, and the pharmaceutical industry has really perpetuated this perception that LDL cholesterol is bad for you. It's not necessarily bad, we need it, right? There's a reason why we have these in our bodies, right? It's just a question of balancing them compared to the other components, the other lipoproteins in our bloodstream. The question was asked, it was asked twice, about inflammation. What can you do, right? Exercise is an easy way to drive inflammation down. Others, right? I mentioned to you about taking fish oil or preferably cod liver oil. Omega-3 fatty acids reduce inflammation. In fact, we even understand exactly how they reduce inflammation. Third, anti-inflammatory supplements. I'll tell you what I recommend our patients. We actually give them a handout. The B complex of vitamins, right? B complex means all 11 of the B vitamins. B6 and B12 in particular, but also B3. I can't remember if I talked about in this group about niacinamide, that's B3, right? That's wonderfully anti-inflammatory. In fact, I take that, the supplements that I'm talking about, our family and I, we take them for good health. And niacinamide has been shown to be profoundly anti-inflammatory. It's wonderful for people who have osteoarthritis, or let's say bone-on-bone knee or hip joints, or shoulder joints for that matter. There's a wonderful set of studies in the 40s and 50s that got buried in the medical literature for reasons that aren't clear to me. I got interested in niacinamide because niacinamide has been useful and has been demonstrated to reduce intraocular pressure. So as a potential treatment for glaucoma patients. Again, because of this anti-inflammatory effect. So in all these patients that were studied with bone-on-bone knee or hip pain, the pain resolved and exactly 0 patients needed a knee replacement or hip replacement. It's not a number. In fact, it is 0. It's kind of interesting. 30, 40 years later, a Japanese group rediscovered this and published it. And they wrote in the title of the paper something to the effect, pilot study on the effect of niacinamide. And I kind of chuckled at it because the person who actually did it was an MD, PhD person in Connecticut some years ago. I wish I had a chance to meet him, but he passed away. He had studied 1,000 patients, consecutive patients, and he had actually worked out the dosing of niacinamide. So the B complex of vitamins to reduce inflammation, right? What I also recommend to patients is dark greens, kale, broccoli, spinach. They're loaded with a compound called sulforaphane. Sulforaphane has been shown to be profoundly protective of the retina, the brain, and the heart. And there's actually some mentors of mine at Johns Hopkins who shows the effect on the retina. But it also is anti-inflammatory in part because it's a wonderful antioxidant, right? So antioxidants and oxidative stress and inflammation are sisters in our cells. So we can quell one, the other one gets mitigated against as well. What I also tell patients about is turmeric, that Indian yellow spice, right? That is potently anti-inflammatory. There's published studies now in the New England Journal of Medicine and elsewhere. In fact, the first clinical trials, as far as I can tell, in the literature, like more than 100 years ago, were done with turmeric, right? So turmeric is a wonderful anti-inflammatory, and it's been shown to be more effective without any side effects compared to non-steroidals and steroids, right? So I tell my patients, there's certain retinal diseases, I tell them to start on turmeric, the B complex of vitamins. So why are these important? And so the other question you may be asking, well, geez, how come we're eating healthy? How come we don't get enough of these? Well, it turns out the nutritional content of the food that we consume now compared to 50 years ago is profoundly poor, right? And as a consequence, we don't get enough of these in our diet, even if we're eating healthy and organic and eating fresh, right? I tell patients, always fresh fruits and vegetables, you can't beat that, right? but you have to consume as much as you can, and even in that instance, I still recommend supplementing. Here's why. There's about 40 to 41 essential vitamins and minerals in all of us, right? And there's studies to show that 80% of Americans are deficient in a set of those. So it would be, short of doing, now some patients want to get this testing done. Genova testing allows us to do it. It's called the NutriVal test. You can actually assess all 40 to 41 essential vitamins and minerals and some others with this particular test. But short of doing that, to me, the most commonsensical way to do it is, given that nearly all of us are deficient in a set of those, is to take a good multivitamin with the B complex, right? Now, silver centrum is not a good vitamin, right? There's studies to show that it gets marketed extremely well on TV and ads, right? What the studies show that when we consume it, it's like concrete. We basically poop it out, right? And it's not really doing anything for us, right? And again, these are published in the medical literature. So a high quality multivitamin with a B complex is always recommended. So what I tell patients is you can take an adult gummy bear, or what we've done is for our, we developed this, I'm a biochemist as well, we developed these as sprays, right? So the impetus for developing them as sprays was our villages patients. They said, Dr. Kaushal, we don't want to take all these pills, right? Can you do something? I said, okay, I've worked on it for a while. So 10 sprays under the tongue, and you're done. And see, the tongue, underneath the tongue, there's a huge vascular bed, so it gets absorbed very quickly. So you're welcome to try it if you'd like, but an adult gummy bear is quite water soluble, and it gets absorbed across the gut fairly well. Most of them do, right? So that would be something to take. Now you have to be careful if you're diabetic, because there's often a lot of sugar in those too, right? So you have to, you'd like it to have xylitol, something like that as a sweetener, or stevia. Yes?
No, I'm just agreeing with you.
Sorry?
Yeah, I'm agreeing with you.
Oh, okay. Okay. So, turmeric, for sure, right, is wonderfully anti-inflammatory. It's quite remarkable. Turmeric is safe up to 12 grams a day. The worst that'll do is sometimes color your nail beds slightly yellow or your hair roots slightly yellow, and that's about it. The catch with turmeric is this. So it's interesting in Indian cooking, right? As you know, my mom, my wife, and most people who cook Indian food, it's always prepared with a little bit of oil when turmeric is prepared to put onto curries and so on. And I always wondered about that when I was a kid. I said, I wonder why that is. Well, so now we know why, right? The active ingredients in turmeric are fat soluble. So in other words, if you buy it from Publix and you sprinkle it on your salad, right? It's great for your gut. It's anti-inflammatory for the gut, so it's good for the gut, but very little gets absorbed, right? So you have to find an appropriate turmeric preparation that helps reduce, gets absorbed across the gut, okay? Yeah, there's many of those. I'll be happy to talk to you afterwards. Yes, yes, yes. Hi. What happened? Oh, jeez. Oh, jeez, okay. Nice to see you, friend. Yes.
Regarding the turmeric, they said, I bought a container like that, and I read that the regular turmeric is fine for the good. Certain turmeric that you get.
Yes.
Does that make sense?
Yes.
Not the turmeric in the store.
The turmeric in the store, it's great. You can. The way to use it, if you're going to use it, is you put it in a little bit of oil, right? And heat it, right?
And heat it.
Yeah, right. Then you can put it on vegetables and so on, right? I'll tell you, like at the Indian grocery store, you can buy turmeric in large bags, right? Because it's used so much. The average Indian in India consumes 1 to 2 grams of turmeric a day, right? And the way it's, like I said, prepared is with some other spices. Turmeric is put with just a touch of oil to basically solubilize these wonderful components that are found in turmeric and ginger and so on, right? Speaking of which, that's another wonderful anti-inflammatory. Ginger, right? Ginger has been shown to be very effective in clinical studies as well. Raw, if you can tolerate it, right? Raw ginger is the best, right? Just munch on it. Now there's even ginger candies, right? They don't have too much sugar. We have them at home. It's kind of fun after. It actually promotes digestion too, by the way. There's studies, it improves the gut microbiome. So you can take ginger if you'd like as well to reduce inflammation. So those are some very simple things you can do. The most important thing not to do is not to have processed foods. So anything in a can, right? The vegetables and fruits in that can are actually intrinsically healthy for you, but the way they prepare it in those syrups, and many of them have soy oil in them. Soy itself is good for you, tofu, right? But soy oil is profoundly inflammatory, right?
So tuna fish in the can, but
Yeah, it's better to have it fresh if you can, right? Always. Now, I'll tell you another thing. It's interesting. There's quite a few of our Villages patients over the last year or so. They asked me about some companies advertising heavily for these fruits and vegetables as capsules. I forgot the name. Do you guys remember? Yeah, it's all that. So I learned of it from our patients.
Yeah, we have those, but what is it?
Yeah. So here's the deal. Here's what I tell patients. It's okay to take it. It's safe, right? But you cannot beat fresh fruits and vegetables every day, 24/7, 365, because what happens is when you freeze dry something and make it into a powder, right, you lose some of the efficacy of it. Same way, for that matter, with ginger and turmeric. I'll tell you what it's not unusual, but like for example, my mother and my wife, what they'll do is you can buy fresh turmeric or ginger, and you put it in some vinegar and let it sit, right? And then you can have that, right? You can eat it. We have it like almost like a little pickle with Indian food, right? And you can eat it otherwise too. You can just cut it up and put it in your the vegetable preparations, or I assume meat as well. So that's really the best way to have it. But those pills of those fruits and vegetables. Now, I had patients, I have to tell you this, right, in the spirit of transparency, they tell me they feel better, and I said, look, I believe you, right? But I tell you, still the best, you cannot beat fresh fruits and vegetables any day, right? That's really the best. How much, right? So here's what I tell patients about greens and dark fruits, right? At least 2 to 3 servings. How does the USDA define a serving? The size of your hand, whatever it's like. I have a big hand, right? Someone has a smaller hand. A serving is that size, okay? So that's what you want to have every day. And that is profoundly anti-inflammatory and is wonderful for every single tissue in the body, for sure.
What do you recommend for fresh fruit?
Fresh fruits, right? I didn't talk about dark. Blueberries, blackberries, raspberries, plums, cherries, strawberries, right? Pomegranate, right? Goji berries.
Almost something like mango.
Oh, look, the question was, what about mango? I love mango myself, right? so here's the way to think about it, right? An emphasis on the dark greens. Of course, you can eat others as well, in limited amounts, because you don't want your blood sugar to go cuckoo, even if you're not diabetic, right? Yes, please.
So if you went taking the turmeric supplement.
Yes. Turmeric
You
supplement.
take, like most vitamins and minerals should be taken with some type of fat. If you took coconut oil, would that do that?
You could do that, right? So the question was, most vitamins and minerals require fat. Actually, the only ones that require fat is D and E. The rest of the vitamins and minerals we consume are water soluble. Okay? So you can take it with some, like for example, let me tell you my own routine, just as an example, right? And there's many ways this can be done. So I'll take a tablespoon of cod liver oil. So we have our own multivitamin as a spray. I use that, right? 10 sprays under the tongue. We have D3 as a spray as well. I do 10 sprays under the tongue, right? Then I take a men's multivitamin to get anything else that I may be missing. I shouldn't call it a multivitamin. It has there's other supplements in it, right? And I take those because some of those are fat soluble, right? So, and that's about all I take, right? Yes.
Is a tablespoon of cod liver oil the dosage you recommend?
Yes. Yeah. It has to be a good quality, right? Cod liver oil, how much? A tablespoon, right?
Whole Foods has Norwegian cod liver oil.
Say again?
Whole Foods has
Norwegian cod liver oil is good. Carlson's makes a very good cod liver oil.
But if you
And-
can't stand the taste, Dr.
So this talk is not to promote our, I'll tell you why we have supplements in our clinic, right? And again, it's not, my goal is to share with you what's important, right? So to me, the foundations of really good nutrition for all of us is a multivitamin with a B complex, cod liver oil, right? Turmeric, right? And also alpha lipoic acid, right? So we develop those for our patients. And they take them, quite a few of them take them regularly. Alpha lipoic acid has this wonderful property of increasing energy production in the cell, right? And it also independently is anti-inflammatory. And it helps regulate blood sugar, which is really important. Yes?
I take turmeric every day.
Yes.
In capsule form.
Yes.
How much is recommended?
Depends on the brand. I'd be happy to review it with you.
I buy it from the vitamin shop.
Yeah, I still want to see what it is, right? I will tell you, I've gone through most health food stores in this area. Some of their products are good, right? And some I wouldn't. So here's the catch, right? I've flown around the country on my own nickel to go find the best ingredients for our own patients, right? And I will tell you, uniformly, these supplement companies, they're well-intended. They're actually very nice people. I have not met one CEO or chief medical officer or chief clinical officer who is otherwise. It's different than the pharmaceutical people have an edge on them because all they care about is the money. That's the honest truth, right? But the supplement world, they're really well-intended people. Many of them simply don't know the science. So they're doing what company B is doing, company C. And they know it's good. They've read something, right? But they don't really know in depth what their ingredients, like some of them, it was kind of funny, in a nice way. I said, geez, are you aware? I mean, this, like for example, alpha lipoic acid. You see, I chuckle because you see the ads on TV to help with nerve pain. I forgot the name of the product, right? Well, here's the deal. 90%, 95% of alpha lipoic acid in the United States comes from China. There's nothing wrong with Chinese products per se. But if you really wanted to take something that's been verified in clinical trials in the US, in multiple trials, from NIH to Cleveland Clinic, it's the German alpha lipoic acid. It's pharmaceutical grade quality. And there's only one company that has that, as far as I know, in the entire US. Okay? So that company, we have it actually in clinic, because what we did was they make it as pure alpha lipoic acid, okay? It's biotech pharmacal, by the way. But here's the catch with alpha lipoic acid, is when you take alpha lipoic acid, I know we're this far away from talking about blood vessels, but since people asked the question. When you take alpha lipoic acid, it also consumes the B complex of vitamins and vitamin C, right? So the proper way to take alpha lipoic acid is with the B complex of vitamins and at least 1 to 2 grams of vitamin C at the same time. So the way we prepared it, we have alpha lipoic acid at clinical doses plus the B complex of vitamins and vitamin C all together. We were able to get that working with this company. So that's the proper way to take alpha lipoic acid. Like the one on TV, right? As I said, it is alpha lipoic acid. I'm not sure where it's from. I suspect it's not from Germany because it's expensive, right? This is pharmaceutical grade alpha lipoic acid. And they don't have these other supplements which they should have in it to really make it effective. Okay? Does that answer your question? Okay. Good. Other questions folks may have? Yes, please.
As talk about vitamin K,
Yeah.
K2 in particular, like whether it be MK7 or MK2.
Yeah.
For the flexibility of the vessels, the artery.
Yes.
And its prevention of cholesterol.
Yes.
Keeping it out.
Yes.
No one very little talk about that, if anything. And I don't know why.
Yeah, you know what, I will give a separate, I'll give you let's talk about it next time. That deserves more time. It's, that's a wonder, I've been asked that before here in this group. And I promised that I'd give a talk and I haven't, but I will next time. That deserves that's not a 5-minute, drive-by.
understand.
But your point is well taken. The K1 and K2, there's multiple K vitamins, right? They're actually good for blood vessels for sure. They're obviously, many of you have heard it, they're important for clotting as well, especially those who are on blood thinners, right? But that conversation goes with calcium and vitamin D3. So we'll cover that next time. How's that? And next month. So we're planning to do this every month. I didn't do it last month because I had huh? I didn't come last month. I was telling Fran and Mary, I had an emergency retinal detachment, so I was hoping to get it done and be over here, but I just ran late in the operating room. But the goal is to do it every month, and it'd be wonderful to have your other friends and family come as well. Yes, please.
Instead of taking a tablespoon of cod oil, which is what my mother made me have when I was a kid and I didn't eat.
Yeah.
I take the fish oil tablet.
Yeah, so the question is, can you take the fish oil tablets over
It's
the...
the one that goes down well.
Yeah, that versus taking the liquid. The liquid trumps it all day long. It's much better, it's a higher concentration of omega-3 fatty acids, right? So here's what I told you, I take a swig, I didn't tell you the full routine. So I take the tablespoon, and then I'll have a sip. I actually have a vitamin C drink in the morning. I take a sip of that, take my other supplement, sip of that, and I've already taken the sprays before that. So I have my family, we have a little routine, how we take these, right?
I love the spray thing that you're talking about.
You're welcome to
I
that.
know about that.
Yes, we're gonna actually, I'm working with a chemist, and we wanna develop other sprays, in part because, as I said, it was, really the driving force was a set of our patients here in the villages, right? We have other clinics as well. And the older folks, it's more difficult to swallow these capsules. Some of them are large, right? So we're going to try to develop, we will develop, now that COVID is sort of receding and people are their businesses are turning around again, is other sprays as well. Even a magnesium and a turmeric spray, right? So coming back to blood vessels, we mentioned I'm going to talk about that in detail next time. But magnesium is also wonderful for blood vessels, right? And at least 400 milligrams of magnesium taurate. The company that makes an excellent, you can get it on Amazon, is Jarrow, Jarrow. Okay. It's great for cramps as well, for those who may have leg cramps, right? Magnesium taurate, Taurate. Yes.
Okay, so my question is this, if you, for irritable bowel disease.
Yeah, I know who that's about. Not you.
Which also causes a lot of pain, it's the brain gut syndrome.
Yes.
Is there anything that's over the counter?
Yes.
To get that pain level down?
Yeah, so,
Or anything up?
omega-3 fatty acids,
Okay.
right? Turmeric. Turmeric is
Supplement.
what is wonderful as an anti-inflammatory, right?
An extra one that's not
Yeah,
a supplement?
yes, I would, is he already taking 2?
No, we're doing one.
Double it, 2.
We're gonna see it Tuesday.
Oh, okay. We'll check his eyes out as
That's,
well.
I'm trying to figure out a way of
Yeah.
getting that pain level down.
Yes,
Because I think that's really what it is.
Yes.
The IBS with the
Yeah.
barrel connection.
can I tell you, it's again a little bit of a sidebar, but turmeric, I could give a talk for a couple, 3-4 hours about turmeric, the biochemistry, what it does, and the remarkable health benefits, right? I've been telling you about the anti-inflammatory effect. Turmeric also produces this response called the heat shock response. Many years ago when I was head of Retinal UF, we demonstrated that the heat shock response actually promotes health of the retina, right? As well as other tissues in the body, right? So turmeric, that heat shock response, you have to take a certain amount of turmeric to solicit it, in other produce it in our body. And that's a profoundly protective response. The heat shock response, we're the first group to show, so turmeric does this as well, is it induces natural stem cells to proliferate in a healthy way. So you have to titrate the amount. Now, eventually, what we'd like to be able to do is have a blood test for it, right? So we're working with a company, when I get some hours here and there, that is to develop a test to monitor how well turmeric and compounds like that are working in the body. Yes? Yes, please.
This is out of left field. Now you say you have to have oil with making turmeric
Yes.
work well.
Yes, yes.
If you have hot coffee in the morning with
Yes.
a tablespoon of coconut oil,
I love it. That's a
when
great
you
idea.
put the turmeric in
You
there,
can
it
do
all
that.
work.
Yes, you can do that.
The oil and
Yeah,
the turmeric.
yeah, absolutely. Yes.
Okay.
That's not, so can I tell you what, we usually have Indian tea, because that's what my wife and I enjoy. But we'll have coffee too, but we use this, I'll bring it next time. The creamer, it's an organic creamer that has coconut oil in it, all right? So, I forgot the name, Bulletproof, that's the name of the company. You can check it out on the web. Bulletproof, that's where we buy it from. Right. Their coffee is amazing too, by the way. So we buy their creamer, it's an all-natural creamer that has coconut oil in it. But yes, you could. Now,
And you're more healthy.
but I will tell you, turmeric is it's a little bit bitter,
Yeah.
right? So you might want to sweeten it with something like stevia, not sugar, but stevia, and that'll sort of, or a monk fruit oil, monk fruit, sorry. That'll help temporize or mask the bitterness of turmeric itself.
How about honey?
Yeah.
I'd rather swallow it and get it over with.
Stevia does not affect blood sugar at all. Yes, it's good for blood sugar. And it's also great for the gut. It's excellent for the gut. Yes.
I take about 4 or 5 pills with dinner, one of which is turmeric.
Yeah, that's excellent. Yeah, keep doing that. Absolutely. Yes, please.
Is there any downside or side effects that you think about when you start alpha lipoic acid?
Are there any downsides of taking alpha lipoic acid? If you take it at the right dose, it's like anything else, right? If you take gobs more, right? So 300 milligrams a day. So I'll tell you why we originally developed this. As you know, the diabetics can sometimes have neuropathy, right? Where their feet tingle, right? And it turns out that's one of the questions I ask them as a retina specialist, because if the feet are tingling, even before I look in their eyes, I know most likely they'll have diabetic retinopathy. So what the clinical studies showed many years ago, including from I think Mayo Clinic had the largest analysis, is alpha lipoic acid is very effective for diabetic neuropathy of the feet, right? And so that's really why we developed it. We know it also has this wonderful property of increasing energy production in the cells. So the answer is no if you take it at the right dose. Okay. Now, the alpha lipoic acid is another one of those compounds that's multifunctional, and we could have another very, very long chat about it. Here's some other amazing things about it. It also helps transport certain fatty acids into the energy factories of the cell. So as we get older, that becomes less efficient, right? So, and it actually chelates heavy metals, right? Like lead, cadmium, which we're exposed to in our environment, right? All the time. And it's a wonderful antioxidant. Now, if you actually open up a capsule of alpha, it stinks, right? It has a very pungent smell to it. That's because there's sulfur in the chemical structure of alpha lipoic acid. That's what binds heavy metals and serves as a potent antioxidant. Okay, let me, we've talked about this a bit. I just want to finish. It's fun answering all these questions. I just want to show you a couple things and then we'll wrap up. It's already 11:15, and out of respect to your time. So we were talking about blood vessel health, right? How do we show? Well, I'll just leave it like that. Let me tell you about this instrument. So in our clinic, I'm always keen to obviously take care of people's vision, right? But also, as what's also fascinating to me is what is there that we can help assess overall health in patients, because the eyes, as I told you, are very sensitive barometer, the retina in particular. So this is an instrument, it was designed by a colleague of mine, MD, PhD, a friend of mine up in Connecticut some years ago. And it's fun to say this, we're the first ones to have it in Florida. None of the major institutions have it yet, but I assume it should be, frankly, it should be in every clinic all over the planet, right? Here's what this instrument does, and that's what it looks like. Let me just show you. Well, I'll just tell you about it, and I have it detailed in the next 2 slides. So many of us get our eye pressure checked. In fact, whenever you go to any eye doctor or eye optometrist, they check your eye pressure. The way that eye pressure is actually measured is either with a device that touches the cornea, right, or on the slit lamp, this microscope. There's an attachment. No, this is the device that I'm talking about. There's a separate attachment. And eye pressure varies with the cardiac cycle, right? It varies with the systolic and diastolic blood pressure. The instruments that are used to measure currently, I mean, we use them as well as we're transitioning to this, is they measure just systolic associated eye pressure. We know, in ophthalmology, we know that that's inaccurate. That's well known. It's until this instrument was developed. It took 10 years to develop it, right? This will measure through the 3 separate measures of the cardiac cycle, the eye pressure. So it averages across the systolic and diastolic blood pressure and 3 different measurements. It does it all electronically. And it gives blood pressure measurement. Now, along with that, it measures how well the drainage system of the eye works. And I'll tell you why all of this is important. I'm just going to tell you in pieces and then connect the dots for you. This is the first instrument that does that as well. But the most important thing from my perspective is it measures something called central retinal artery perfusion pressure. That's the first time we can measure it non-invasively in clinic. Why is that important? We've been talking about vascular health, and we talked about supplements to some degree. This is the first time that I'm aware of that we can measure it routinely in clinic. Usually it's done in a research setting. The central retinal artery is the main artery that perfuses the eye. And every retinal disorder you can think of, right, from glaucoma to macular degeneration to diabetic retinopathy to strokes of the eye, strokes or mini strokes of the eye, all are related, we know this from academic studies from years ago, are related to decreases in central retinal artery perfusion pressure. And what affects central artery perfusion pressure? Number 1 is atherosclerosis of the blood vessels within the brain, right? It's called the circle of Willis. I think I may even have a slide. No, I don't. That was to really impress your friends, right? But so here's the thing, is that circle of Willis, it's now well recognized, influences the development of glaucoma, macular degeneration, diabetic retinopathy, for sure. Those are and glaucoma, right? Those are the big disorders of the eye that we see routinely as ophthalmologists and retina specialists. And so what's really exciting is we can actually now measure it in a routine manner in clinic and have really reliable numbers on this, which as I said before, it would have to be done in a research setting. And of course, I have to tell you, some of you asked me this even before, this is all covered by insurance, which is even more amazing to me because these tests have, or this instrument's been around, it hasn't really caught fire in part because I think it takes a little more effort to do the testing, but it turns out from my perspective, it's extremely meaningful for patients. Now, here's the thing. is, so in a way, it is now a direct measure of the health of the central retinal artery, which is, as I mentioned, the artery that's perfusing the eye, right? Providing blood supply to the eye. Why is that important? It turns out that's important because the circle of Willis, this artery comes off the circle of Willis, which is in the middle of the brain, and that the origins of the circle of Willis are the carotids, right? So now we all hear about getting carotid ultrasound done, right, and so on. That's a good test, but it doesn't really catch carotid disease, by the way. I'll say it again, it doesn't really catch all of carotid disease. The bulk of carotid disease is in the internal, not the external carotid, 75% of it. And there is now a separate test to do that as well. It's called transcranial Doppler. It's very similar to the ultrasound that we do in clinic for patients to check if they have a retinal detachment in patients who have a dense cataract or bleeding in the eye, and other measurements we do in ophthalmology. So what I'm getting at is there are now non-invasive ways, you don't have to go into a hospital to get these tests done, where we can actually assess the health of someone's blood vessels, both by looking right at the retina itself, which gives us a sense of the structural integrity of the blood vessels, but separately, we can start understanding the flow of blood to the eye, and of course, because of its connection to the circle of Willis and the internal carotids, gives us a sense of atherosclerotic disease elsewhere in the body. Okay? Yes?
So if you're doing, because you're looking at circulation through the circle of Willis.
Yeah.
If you're doing Beamer.
Yeah.
Across there, how deep is it going to penetrate into?
I don't know. The question is, can Beamer affects typically the microvasculature beds in the body, right? So these are larger blood vessels.
It should help that too.
It should, but it depends on how, because the circle of Willis is like in the middle of the brain, right? So I'm not sure if it would help it per se, but perhaps, I haven't looked at the literature more recently, but perhaps somebody has studied it, okay?
No, the FDA says we shouldn't be using it on the head, so.
Okay, so there you have it. All right,
But we do it anyway.
good. It's already, oh my gosh, time flies. It's already 11:25. Can I answer any other questions for anyone just now? Yes, please.
Like, so we're finding out what the issues are when we do all these tests.
Yes.
We want to know what the fix is.
Yeah. So I told you some of them along the way, right?
Okay, yes.
So I shared with you the tests that are useful, especially around lipoprotein, right? The things that you can do for that, right?
And is there an estimation in time from the time you start taking these?
Yeah, okay, that's a wonderful question. Suppose a treatment is given, either supplements and or pharmaceutical agents.
Okay.
How long does it take? So let's say a patient with elevated Apo B levels, right?
Okay.
And you want to drive those down. Now, there's multiple factors, including genetic factors, that influence Apo B levels, right? So it's variable from patient to patient, but what is reasonable to do is get blood work every 2 to 3 months. That way you can actually monitor if the treatment is working and or if the supplements and or drugs had to be tweaked along the way, okay?
All right.
Good. Other questions? So I'll stop here. We'll continue on next month, okay? So, Fran, it's going to be every...
Every first Saturday of the month.
Yes.
Here, not an hour. Never know the room, because they change.
No, we had this room.
one, Carl? Okay.
Yep.
So-
This is a nice room. This is the first time, as I said, this is the first time I've been... Yeah, this is very nice.
So it will be every first Saturday of the month at the same time.
Very good, thank you.
Will it still be the Tuesday night?
Oh, yes, yes, this is a supplement to that. Because Dr. Kaushal runs clinic some nights till 8:30, so it's not convenient for him to be nights, and he's generously coming from Gainesville to here every Saturday, the one Saturday a month for us. See?
Yeah.